and welcome to Appropriate Glove Use by Axiom Medical. For the general public, wearing gloves is not necessary in most situations and can provide a false sense of security. The CDC recommends wearing gloves when you are cleaning or caring for someone who's ill. In this training, we'll review when to wear gloves, when gloves are not needed, and appropriate procedures for putting on and removing gloves. Gloves should be worn when cleaning or disinfecting surfaces, along with caring for someone who's sick. Be sure to use disposable gloves when touching or having contact with bodily fluids, such as saliva. Though gloves are intended to provide protection, they can have the opposite effect, spreading germs within the community. As germs collect on the glove when touching surfaces such as elevator buttons, grocery carts, and gas pumps, wearing gloves for such activities is not typically warranted. Prior to applying gloves, wash your hands with clean running water. Apply soap, rinse, and dry. When applying gloves, first remove a glove from the box, making sure there are no holes or tears in the glove. Align the glove fingers and thumb with your hand. Insert 5 fingers into the cuff and pull the cuff over the wrist. When complete, perform the same procedure to your remaining hand. When removing gloves, first grasp the outside edge of the glove near the wrist. You'll next want to peel the glove away from the hand, turning it inside out and hold in the opposite gloved hand. Slide an ungloved finger under the wrist of the remaining glove, being careful not to touch the outside surface of the glove. Peel the remaining glove off from the inside, creating a bag containing both gloves, and appropriately discard. After removing gloves, wash your hands again with clean running water, applying soap, rinse, and dry. Key tips you'll want to keep in mind include gloves are not a substitute for hand washing, and they are not a complete barrier. Disposable gloves are single use and should not be washed. Hands should be kept away from your eyes, nose, and mouth to prevent germs from entering the body and causing infections. This concludes appropriate glove use training. Should you have a question, contact your COVID compliance officer.